The risk of family members getting together is this.
You must stay at home. Whatever it takes. We will beat the coronavirus, and we will beat it together.
Throughout the lockdown, various strategies have been reported about how the government might lift the lockdown. Obviously, in public, ministers aren't saying anything, but we've learned that their thinking includes embracing ideas like phasing re-entry to schools. And also, this is an interesting one because it's been used a lot in Australia and New Zealand, which has had a successful, tougher lockdown, introducing bubbles, which would mean that we're able to see up to 10 people to socialise. Dr Hilary Jones is here. Hilary, you've obviously looked at all of these reports. Clearly, the government haven't decided yet which approach they want to take. But what do you make of this idea of allowing us to see more members of our family and friends? Because it is something that seems to be very successful in Australia and New Zealand.
Yeah, it's an interesting concept. It's something that everybody wants to do, isn't it? We desperately want to see our close family and those nearest and dearest to us. Of course we do. And the benefit of that would be for our mental health and our well-being and our happiness. And the thinking is that by seeing just our close family, that we can still socially distance, but be very careful with not seeing them if we've got symptoms, for example, or we know we've been in contact with anybody with COVID-19. But it enables us to see a limited number of people, not the whole world, as we come out of lockdown. However, we have the advantage in the UK of seeing how it pans out in other parts of the world. In Italy, for example, we'll see how the end of lockdown pans out there, perhaps happening before our phasing out of lockdown. The risk of family members getting together is this, that we tend to be closer physically as well as emotionally to our family than we are to everybody else that we know. We tend to forget the rules of social distancing. We naturally want to hug our mum and our dad, our brothers and our sisters and other members of the family. And therefore, it has been suggested by some experts in the UK that actually that's the worst group that you want to allow to get together in a bubble, because they're going to be much closer and more likely, therefore, to transmit the virus. So I think it's an interesting idea. It's something that we would all love to happen, but let's see what happens in countries where this is happening, and hopefully they'll be tracing what goes on and testing to see whether it's worked or not.
Wow, so many questions for our experts to answer. But we've also had so many questions for you to answer, Dr Hilary. Of course, you can send your question using the hashtag Ask Dr Hilary. The first today is from Bill Jordan. And Bill asks, my father is 85. He goes out pretty much every day. Today he was out for about 2 hours. He will not listen to me and thinks he'll be fine as long as he has his mask on. I'm finding this very stressful. What can I say to him?
Well, so many people have the same dilemma. They want to shield and protect the elderly and the vulnerable, who sometimes just won't listen to the reality of the situation. Should they come across the virus, of course, they're much, much more vulnerable, and many of them wouldn't survive an infection with coronavirus. And you can sometimes tell them till you're blue in the face, but if they want to go out, they can. The guidance that we give them is simply guidance. It's simply advice from the people who are in the know. It's not a dictate. It's a diktat. It's not something that we can force upon them. If they want to go out for their daily walk and their exercise, we can't force them to stay at home. But they must realise that they have to really be disciplined about social distancing to minimise their risk. Wearing a mask may or may not help. The evidence, as you know, is not clear on that. It probably doesn't do any harm if he's out for a walk, but he is more vulnerable. And as long as he understands that, what more can you do? Because at 85, he probably feels he wants to live his life. He doesn't want to feel incarcerated at home in his last few years. And he's probably thinks that he's taking a reasonable risk.
The next question is from John Holt, who asks, how many people who are admitted to hospital with COVID-19 later get discharged?
Well, most people, luckily, will get discharged. It's only the very sick and a small percentage of people who get severe symptoms and who need intensive care, ventilation, oxygen and other supportive therapies. Thankfully, it's the minority. We think that the mortality is about 2%, 3% in hospitals at least. In care homes, it might be higher than that. But I think it's important to realise that some people get no symptoms, some people get moderate symptoms, some people get moderate to severe symptoms and will need to be admitted to hospital for help with breathing, but the vast majority of them will be discharged and will make a full recovery.
Now, we've been sent this from Anita White on the hashtag Ask Dr Hilary.
Hello, this is my question for Dr Hilary. How long can a person who has shown no symptoms but has been exposed to the coronavirus be contagious? Thank you.
OK, well, they may not be contagious at all. Just because they have come into contact with somebody who's proven to have COVID-19 doesn't mean to say that they've been infected. So they may not be contagious at all. Let's supposing that the virus has transmitted to them and they have no symptoms. We know the incubation period is about 5 to 6 days. And we say the guidance is that anyone who's been in close contact with somebody with known COVID-19 should self-isolate for 7 days, because by that time they will be incubating the virus. They would normally get symptoms within that 7-day period. If they haven't had any symptoms, they can come out of self-isolation and go about their normal activities. So hopefully not contagious at all, but even if they're asymptomatic, they could be, but not if they haven't got symptoms after 7 days.
Great advice. Thank you, Dr Hilary. And of course, if you do want to ask any questions, you can go to thesun.co.uk/Dr Hilary or talkradio.co.uk. And Hills will be back to answer more of your questions tomorrow. Thank you, Dr Hilary.
Thank you, Dan. Take care of yourself.